Hello, my name is Isra Al-Rubai, and here is my media project. What is an OBGYN? An OBGYN stands for Obstetrician Gynecologist Specialist, a healthcare professional that specializes in female reproductive health. Working as an OBGYN means that the doctor was trained in both specialties, obstetrics and gynecology. Obstetrics involve working with pregnant women, including delivering babies. Gynecology involves the female reproductive system. Gynecology involves the female reproductive system, treating a wide range of conditions, including sexually transmitted infections such as STI and chronic pain. What does an OBGYN do? The work of an OBGYN doctor focuses on the health of the woman, which includes providing a wide range of preventive care services such as pap smear, STI testing, pelvic exams, ultrasounds, and blood work. OBGYN doctors are able to answer patients' questions about pregnancy, sex, reproductive health, and numerous other topics in regards to the reproductive health of women. The recommendations that an OBGYN usually give to his or her patients vary with age and also change over time as technology develop and new methods of treatments come out. The type of procedures that an OBG can perform. OBGYN doctors are trained surgeons who can perform a variety of procedures, which can include C-sections, using certain tools to help a woman deliver her baby, and those are only for certain situations. They can also do a hysterectomy, which is removing the uterus. There are other procedures that an OBGYN can do, such as removing a cyst from an ovary or repairing pelvic organ injuries. Other procedures that an OBGYN can do at their office that don't require to be done at the hospital, although they can be done at the hospital. Those procedures can include pap smear tests for cervical cancer, STI tests, breast exams. Some OBGYN doctor offices have the tools or the equipment to do a mammogram, some don't, and in that case, the patient is required to go to the hospital to have that done. Besides the care for the reproductive health of women that an OBGYN focuses on, those doctors can still help with general conditions that might contribute to the overall well-being of the patient. Those general conditions can include screening for mental health issues, filling prescriptions for common conditions such as high blood pressure, or treating thyroid issues, any general diseases that OBGYNs are actually able to help with, and they usually don't refer their clients to specialists for those. Areas that an OBGYN can specialize in. Even though an OBGYN gets trained in both obstetrics and gynecology care, they can still choose to work on to focus on one of the other. They don't have to do both. They can do both if they want to, but they're not required to do both. They can choose one over the other. Also, some OBGYN doctors decide to focus on a specific area in that field, and that's an option as well. When someone should see an OBGYN, according to the American College of Obstetricians and Gynecologists, a person should have their first visit with an OBGYN doctor between the age of 13 and 15. People should see their OBGYN if they are pregnant or they think they might be pregnant or they have any reproductive system issues. Some women consider their OBGYN doctors as their primary care doctors, and that is okay. Usually, OBGYN doctors recommend having the first pelvic exam and pap test around the age of 21 as the person becomes sexually active. Although this is those two tests are recommended at this age. However, doctors still encourage people in general to be seen early at an early age so they can build a good relationship with their doctors. If the person is healthy and free from any health issues, they are still recommended to be seen by an OBGYN at least once a year so they can get their annual checkup and maintain their good health. What qualifications do you need to become an OBGYN? After graduating from high school and college, it is required that a person finishes 4 years of medical school. After finishing 4 years of medical school, doctors are required to have 4 years of residency in order to become an OBGYN. Some doctors who choose to have a specific specialty in a specific area in this field, they might have to do more years of residency in that case. But the minimum requirement is 4 years. After finishing the residency, there is a board examination that all doctors are required to take and pass in order to be licensed. Um, and this exam include an oral exam that takes 8 hours. Here are my references. Thank you.